Welcome back. Hot search right now. How does Ozempic work for weight loss? Online health coach reacts. In this video, I'm going to tell you how Ozempic works, what it can do, and four things that it can't do. Let's get started. My name is Reggie. I'm the founder of Fit for Freelance, where I build adaptive business leaders through compassionate health coaching. I've been covering Ozempic, semaglutide, Wegovy for a long time. I was even at the American Diabetes Association conference a couple years ago, working on medical news coverage, and I've been covering on my channel. So if you've been missing it, come check me out on YouTube and subscribe. All right. And this is going to be huge. This is going to be groundbreaking thing in the healthcare industry as we talk about obesity prevention and response, chronic disease prevention, all this. So I want to make sure you know how this works because it's a hot search right now. Okay. So Ozempic, also known as semaglutide, was approved in 2017 by the US Food and Drug Administration for use in adults with type 2 diabetes. It's been approved by lots of regulating agencies around the world. All right, so what it is a peptide, which is part of a protein that mimics a hormone called glucagon-like peptide 1. Semaglutide activates the GLP-1 receptor, so it is called a GLP-1 receptor agonist. So you might see GLP-1RA when you're talking about semaglutide. And let's take a look at some of the actions, how it works. It is the first indication is for diabetes, so you'll see some effects on that. But in terms of the specific question you might have searched to find this, how does Ozempic work for weight loss? Some of the major things, it decreases your appetite in the brain, the hormone signaling there, and it slows your gastric emptying. So you'll feel fuller longer because your food takes longer to leave your stomach. So that's also going to affect your appetite. Other things that affect your appetite, increase in insulin sensitivity, increase in insulin secretion, and decrease in glucagon secretion. I'm going to go too far in depth. If you want to talk about it, send me a message. And I'll tell you all about how it works in depth, or you can find another resource for that. Okay. So Ozempic, however, is not FDA approved for weight loss, though it has weight loss effects and is sometimes prescribed by doctors to reverse prediabetes, including insulin sensitivity and help with weight loss. All right. Ozempic comes in the 0.5 milligram, 1 milligram, and 2 milligram doses in a weekly injection. So if you look at what is indicated for weight loss specifically, Wegovy is a once weekly 2.4 milligram injection. So the other doses are lower in Ozempic. Wegovy has a higher dose, and it was approved by FDA in 2021 for chronic weight management. And so what you find with these semaglutide, these injectable drugs for weight loss, is a smaller dose usually means smaller effects. And so if you are interested in learning more, you can talk to your doctor to find out if it's right for you. Now, as a health coach with a background in medical writing and public health, I have a different understanding from a doctor who works with patients. They have their own protocols and licensures and all that stuff. So talk with your doctor if it's right for you. And I want to point out, don't pay too much attention to the layperson's opinion on Ozempic. It's one of those things that's very popular and a lot of people can develop an opinion on it, but they probably don't have a very good understanding of how the body works, how medications work, the behavior of health change, all these things. So you want to make sure that you keep it in perspective and don't just jump to whatever everyone is saying online about it, because it can be very misleading and confusing, and lots of misinformation is available online. All right, I want to go on to say that semaglutide, Ozempic can be a tremendously valuable part of your healthcare plan, reducing your risk of potentially deadly chronic diseases and things that can be very urgent. So that's why it's up to you and your doctor what to do about Ozempic, semaglutide, etc. All right, I talked about some of the drawbacks, some of the risks, some of the questions surrounding semaglutide, Ozempic, and Wegovy, and these injectable GLP-1 receptor agonists. In the step 4 trials, the Wegovy dose showed that people who stopped taking semaglutide started to regain the weight they lost. I put a link in the description below on YouTube so you can learn more about that. Here's a quick chart where it shows that they gave all the patients Wegovy for 20 weeks. And then after that, they switched half of them to a placebo, which is like a fake injection, basically, or an injection that didn't include semaglutide. And the other group on the bottom, the purple group, continued with their Wegovy dose. So what you see early on is 20 weeks that Wegovy is probably definitely effective for weight loss, but then after you stop taking it, you're likely to start regaining the weight. And I've covered this in another video about Remy Bader and some of the stories that come up about people who are regaining weight after they stop taking Wegovy. And so, as a health coach who helps people with the behavior change, I kind of think of it as training wheels for weight loss, just in my own perspective, not as a doctor. So, it's up to you and your doctor, but it's one of those things that seems like you're going to need to take long term and discover and develop new health habits underneath that. So, what I want to do is talk about things that Ozempic doesn't do. All right. And it doesn't directly address the factors that contributed to weight gain in the first place, which is probably the biggest challenge. The biggest reason that people start to regain is that they haven't really taken any other changes. They decreased their appetite, they slowed their gastric emptying, so their stomach stays full longer, but they haven't really changed anything else around the environment. So, four more ways to get more in depth about what Ozempic and semaglutide doesn't change. It doesn't change our food environment, food policy, and culture. And this is something I work on in my public health career, is understanding that food and what we eat and how we behave is largely dependent on what we surround ourselves in, the culture and environment we have, of the foods that are readily available and accessible, foods that we can afford, all that stuff. So if you don't have access to healthy foods, or you don't have a habit or a way to get them into your mouth readily, then that's going to affect it. Also, the urges that we see when we're watching TV and we get food ads with less healthy foods all the time, that's going to be a key environment element that can impact the choices that you make. So this is something that becomes more apparent if you consider it deeply. Also, recently, Live to 100 Secrets of the Blue Zones on Netflix. That's really insightful kind of documentary on how your environment and culture can really impact your health, your food choices, and your longevity, obesity incidents, if you're likely to gain weight, all that stuff. So check that out. Two, what Ozempic doesn't do: change how you manage your environment and make choices in it. In other words, or one example of this, it doesn't teach you how to eat healthy. It doesn't make those choices for you. It just reduces your appetite. So if you want to learn more about how to impact that, I have the Health Confidence Club and the full plate sessions linked below. It's all about eating more plants, basically. A lot of people not getting enough fiber, not eating enough fruits and veggies, and that can cause you to eat more calorie dense foods, increase your weight, and then you have problems with that. So Ozempic can't really help you with that. That's a decision process that you have to make. That's number two. Three, what Ozempic doesn't do: it doesn't increase your lean muscle mass or give you a toned athletic figure. This is a big thing for many people when they want to lose weight. They don't just want to, be lighter. Like, that's always the first thought is, I want to lose weight, but you just stand on the scale, your number's going to change, but that's not going to affect much of how your body looks in terms of like the physical shape that you might be looking for in terms of athleticism, being toned, muscle mass. For that, you would probably need some kind of strength training program, weightlifting, bodyweight yoga, anything to increase the muscle tone and not just burn the fat and decrease your appetite and things like that. So that's something else that Ozempic can't help you with. Other questions that we have about Ozempic: costs in your specific situation, side effects, availability. This makes it so it's not necessarily easy to access. It's not yet covered by insurance. A lot of insurance providers, could be some long-term side effects that we are waiting to kind of see. There are some risks on the box that you can check out. They also have that online. And is it available? There was a huge shortage last couple of years in these semaglutide drugs, because so many people wanted it. It's a hot story. Celebrities are taking it, all that stuff. And the fourth thing, what Ozempic doesn't do: it doesn't support your self esteem while you take confident ownership of your path to freedom and fitness. So it doesn't really build that confidence. A lot of times when you are making a change, you want to feel like you're more in control of the choices that you're making. Increase your self efficacy, know that you can do what you intend to do, and taking a medication may support that, but Ozempic doesn't do that directly. That's not on the box as a listed primary effect of the medication. This comes from setting a vision, building a practice, and focusing on the right things. And that's something that I can do with the guilt-free game plan, if you want to build the body you want so you have more confidence and more energy to lead to healthy, fulfilling life of your dreams with or without Ozempic, subscribe to my channel on YouTube, because this is what I'm talking about all the time with all the stories. So we help you build confidence, realistic focus, and accountability. So you have that confidence, you know that you're in control, you're in charge of your life, and you can take ownership of it. All right. So click like if this makes sense to you. If that answered your question, how Ozempic works, some things that it does, some things that it doesn't do, add some context. And I've also got a full playlist on YouTube. So check that out. Then if you're on YouTube already, you can watch Wegovy Rebound Step 4 Semaglutide Weight Loss Trial Results. So you can see more about that trial is talking about, how the effects don't necessarily last longer than when you're taking the drugs. So that's today's message. Leave a comment. Let's chat and keep practicing. Peace.